Hi, everybody. When I think about why we are doing this work, you're spending a day in this room. I've come all the way across the country to talk about this. It's really about what is the impact that nurses can have. And so when I think about this, I start with my imagined world of what it would be like. And I'm going to describe a little bit of my imagined world. And I'm going to give you 5 examples of nurses making a difference. And 4 of them are true. It's already happened. One of them is not true. And I'll be curious to see if you can figure out the one that is not true yet. But in my imagined world, and this has truly happened, a nurse was on their community transportation board. And the nurse said, why don't we have bike lanes? That could help with congestion, that could help with people's health. And the whole community really changed, and the health in that community changed because a nurse was on that board and stepped up and said, this could help all of us. So in my imagined world, this is one of the things that is about daily life. And when you think about the social determinants of health, it is not just about nurses on hospital boards, but it is how do we make a healthy community and a community that has accessible resources for people. So in this world, you have this couple who are going to a community health center. And they're at a community health center because a nurse is on the mayor's task force on health and said, why don't we invest in nurse-led community health centers? And I know of a city that this happened in, and they started with 1, and then they had 5. And you all know, nurse-led practices are fabulous practices. And so in this community, there was community health that was easy and accessible because a nurse got on a board and said, why don't we do things differently? In this world, this actually is a nurse, and this nurse is out on her lunch break, right? Because there is a nurse that is chairing the quality committee at this hospital and worked very hard to get the group and her fellow trustees to understand the quality of patient care related to the quality of lives of those who took care of them. And so you should get a break, and you should be able to go out at lunch, and you should be able to be a person in addition to working. In this world, this person is sitting on a bench. They were home ridden for a long time until there was a nurse who worked with their state payment and policy out of their hospital association board to get reimbursement for home care. So this person could get the care that they needed in their home and get out into the world. And in this case, this is a couple that is taking their child to an affordable daycare center in their community. And the daycare center exists because a nurse joined a for-profit board and joined their philanthropy committee and said, I know how we should be investing money in this community. We should be investing it in childcare because childcare makes a big difference to how people live their lives and how healthy they are in their community. And so they made a gift, major company made a gift to childcare. So, this is the world that I want to live in. It's not the world that we live in, though. So I know I have 5 examples. 4 of them are from disparate cities and places. They've all happened, but they haven't all happened in the same place. And this is the world that I want to live in. And as Jana said, I'm not a nurse, but I have spent a good 2.5 decades talking about how the world would be different if your voices and your power were more evident. And so this project really resonates. Can anyone guess which was the example that wasn't true yet?
Probably the
Nurse at lunch. Yeah, no, that's the one. That's the one. Yeah. Go on, you got that really quick. So why am I here? So I am the executive director of the American Nurses Foundation. It's the philanthropic arm of the ANA, so the credentialing and certification, advocacy and professional, philanthropic and policy. And we were one of the organizations that helped fund and create the Nurses on Boards Coalition. And actually, we have been the home to the coalition for the last 18 months. In about 3 days, we will launch it as an independent organization. But we have been doing this work since 2013. And I came to this work because I really had the greatest fortune of working at the University of Pennsylvania School of Nursing and being in an environment where this group of nurses, men and women, just always assumed that they had a place at the table. And it is out of the University of Pennsylvania that the only nurse who has ever led an Ivy League institution as president of the institution happened to Penn when I was there, and I saw her lead out of her nursing expertise. And she really led that institution institution as a nurse, and it was really incredible to see. So I came from this place of course nurses should be at the table. They should be at every table, but they aren't yet. And I also bring to this as a non-nurse somebody who right now as an executive director, I have a board of directors. So I have a board that I nurture and feed and have expectations of. And so we'll talk to you a little bit about what makes a good board member in my mind. I have been the president of a board. I've been on a board. And I've worked in nonprofits all my life. And so I've been an employee of organizations that had boards, good boards and bad boards, engaged boards and not engaged boards. So for all of you, it looked like, as I looked at the attendance, it was like half academia and half direct healthcare. All of those places have boards, and your day-to-day life is affected by the kinds of decisions they make and how engaged or not engaged they are. So I did say I was going to go a little through some of the things quickly, but this is something we haven't focused on this morning in great detail. So this is what boards do. There are, I used to have 6 things on this slide, but now I've made it 7. There are really 7 responsibilities that boards have, whether they are for-profit boards or whether they are not for-profit boards. And they are, provide financial oversight to the organization, ensure that it has the resources and that it is managing those resources well. Doesn't mean you necessarily have to have an MBA, but that is one of the core responsibilities of any organization, is that you're looking at the books, you're making sure that things are operating the way that they should. Assuring quality. So that could be assuring quality of the product, if you're creating a product, you're a company, or the quality of education, if you're a trustee of an educational institution. So ensuring that what the company or organization is doing matters. Setting strategic direction, and we're going to talk a little bit about what setting it means versus directing it and operationalizing it, but setting the direction of where the organization is going to go. What does the future look like? What are they there to do? I think of nonprofits as being in the business of solving a problem. So as Jennifer spoke this morning, what are the trends? What are the problems that we're going to need to be solving in the future? Obviously, we got to solve problems today, but boards are really about thinking about where is this organization going? Setting the policy for an organization, approving the policy. That doesn't mean necessarily creating the policy, but setting the policy and standing behind that policy and saying that this is a good organization. Governance, good governance, and I think Leda made a great statement about it is, and Jana, you did too, it is not, part of a responsibility of a board member is to assure that there is good governance going on, and part of that is to assure that there's diversity. And I will have to say that in my 30 years of working in nonprofits, I don't have a lot of board members coming and saying, I don't think our board is diverse enough. And that really is a responsibility, because if you're going to govern well, then you're going to look at that data that says that the same people thinking the same things doesn't make a great organization. Part of your responsibility is to say, do I have diversity at this table? That's part of my role. It's not just to get there, but to ensure that your colleagues on that board are doing well. Good job. Oversee management. And then the last one that I added was ambassadorship. So whether you are sitting on a board of a company and you need to be not necessarily talking about what you know as a board member about that company and the workings, but you are saying, this company is the best company. We have the best products, because I've been assuring that the quality is really good. Or if you're on a nonprofit board, you are taking the opportunity to say, so I want my board members to say, I'm on the American Nurses Foundation board. This is what we do. We do it really well, and be ambassadors into the community for what you do. Organizations need those board members to speak on their behalf. So this is what boards do. What do board members do? So the most important thing, and you heard a little bit about this today, is that you engage. And I was saying at lunch that I think that this is a fast track for nurses moving up in an organization and on a board, is the level of engagement. Every single executive wants a board member who arrives well-informed. And when you commit to a board, you're committing to maybe missing dinner, leaving your family that you love, and going to a board meeting, and not just showing up and figuring, I can flip through this stuff and catch up really fast. You need to arrive knowing what the issues are, having done your homework. And I think that we know that nurses aren't on as many boards as they need to be. And I think that this would be a really fast track for nurses being able to just be on a board and then move up into leadership in the board. Who shows up prepared Asking questions, that's another responsibility, to ask the questions. How is this really working? Not necessarily to say, are we offering pink or blue, but are we hitting the targets that we said we were going to hit? Are we assuring that there's quality? Are we doing satisfaction scores? That is, and again, whether you're on a synagogue board or you're on a hospital board or an education board, asking those questions is part of what board members do to be able to live out those responsibilities of a board. Being professional, and that goes with engaging, right? Arriving ready and able and professional and taking it really seriously. I was talking to someone about how some boards seem like they're rubber stamping things. Well, if you're not engaged and you're not showing up saying, hey, listen, this is my responsibility. I'm on the hook. I am ultimately the leader of this organization as a board. That's absolutely what board members need to do, and to both be professional in how they show up and then what they do afterwards. I remember one board that I was leading where we had a really difficult personnel issue to make. And a board member went out and talked to the community about a decision we were making. And it really jeopardized the whole effort that we had done. And that was really unprofessional. They were not keeping the confidence of the board, and that is a basic responsibility of a board member, is to keep that confidence. You know, when you walk into that boardroom, you can share all of your agreements and disagreements, but when you walk out as a representative of that organization, and that was really painful for everyone, and they regretted it later, because in the end, it didn't serve any good that they operated as that independent agent. To give, so certainly when we're thinking about nonprofit boards, there is an obligation to support that organization, and I think sometimes nurses think, well, I can't write that huge check. There are some boards that require huge checks, right? But most don't, and I know that I would much rather have a board member who could write a smaller check, that they said, I am totally prioritizing this. I can't give as much as this person sitting next to me, but I am showing up and I am engaged and I am doing all the things that you asked me to do. I would much rather have that board member than someone who can write me a $100,000 check, honest to God. The board members are the partners of staff to make sure that an organization is going in the right direction, but giving absolutely is a responsibility, and nurses can give and should give, and I run a philanthropic organization where I believe that everyone can give. Even if you think, I'm joining this board and I'm going to have 4 less Starbucks coffees this month, right? And that's going to probably be about $20, and the next thing you know, you're giving $250 to your organization. You might not have thought about writing a $250 check, but those 4 coffees, right? You can actually probably set aside those 15 minutes you're drinking your coffee and read the board materials too. Like it can all feed together. Thanking people and thanking the staff. That is a responsibility. I think Jennifer talked about board service, and that's something that I don't see enough out there is board members thanking staff for what they do every day. You come in and out as a board member, but the staff are living it out. They're living out some of the harder things that they tell you about, but you don't have to live through. And the board members who thank are just so well loved. So that is I think it's a board responsibility, is to thank the staff, and to lead versus do. So Jennifer talked a little bit about that, and this is a resource that you have right in your community, because I borrowed it from the toolkit that you all have, and it talks a little bit about what boards do and what staff does. And the board sets the policy, the board asks the questions, the staff really operationalizes it. Now the board can say, did you operationalize it well? Show me that you operationalized it well. Show me that the staff satisfaction scores are up. But it isn't necessarily to get into the weeds and to decide, should we be selling this or not? Should we be serving chicken or fish? Leave that to the staff to do. You focus on the big questions and help them get out of the day-to-day, right? Because that's where staff live, is in the day-to-day. But boards come in with this perspective of, in addition to the fish and the chicken and making sure the lights run, or the lights are on and we're running, what should we be doing? How do you know that we're ensuring quality in our educational program or our Meals on Wheels, that our meals are the best? So I've done a little bit, and you have the slides, so I won't spend a lot of time, but a little bit of what are the board responsibilities? I looked at the 7, and then assigned what are the staff responsibilities there? And it is a partnership. And one of the responsibilities of the board is to really oversee the CEO and support the CEO, right? So that you're not having this conflict of, well, the CEO thinks this and the board thinks that. That should be worked out between the board and the CEO. So part of the board's job is to support the CEO. Good governance. One of the things that staff's responsibility is to provide the data that boards need to ensure that quality, good governance, financial management. And if you're not getting that, I once actually quit a board because I said, I get the finances 2 hours before I walk into the board meeting. I can't carry out my responsibilities if I don't have time to really look there, because when I sit there at the board meeting, I can't ask good questions because, I have to get out last month, I have to get out this month, I have to see what makes good sense. So as a board member, you need to be asking not for too much data, right? Because you could get swamped with too much data, but what is the essential information I need as your partner staff to make sure that we're doing the right things? So when you look at what boards do and what board members do, I see all the competencies that nurses have. The ability to communicate, the ability to listen, the ability to problem solve, to see a bigger picture than chicken or fish. Nurses bring that to the table, and we can talk a little bit about how you translate that knowledge into how you describe what a board member does. But there are assessment tools that the Oregon Nurses Center has that you can look at and take a test. We've talked a little bit about why nurses, why now, and in this national conversation, we go back and forth between hospital boards and all boards, and part of it is because we've got a little bit of data on hospital boards. So when we think about why now, certainly the Institute of Medicine, certainly the ACAs, and now perhaps the demise of the ACA, but that it goes back to that place of nurses have this critical voice. And I will say that in my experience over the last 20 years, I find more people willing to listen to nurses and listen and be open to the idea that nurses have expertise that they haven't had around the boardroom, and oh my gosh, we need it. Part of that is out of the whole startup world where they don't come at this whole power differential. They want somebody who's going to provide value right away to creating the best product there is. And so they're like, if a nurse knows, oh my gosh, I want a nurse sitting on my board. I want a nurse influencing the products because I want to get the best product out there so that we can make the most money out there. But I'm hearing CEOs listen in a different way to, oh my gosh, we just had one of our board members who's the former president of ANA just joined the Dana-Farber board. And in conversations with the CEO, he said, it just didn't occur to me. Somebody hadn't sort of raised their hand and said, I want to be on this board. Why don't you have a nurse on this board? And it really wasn't very long before when she did that and that conversation happened that she joined the board. So some of it is this messaging that the world is getting. And AHA has pushed out there that there needs to be nurses on hospital boards. There are lots of amplifying messages. So I think this is a unique time for nurses to have this place that their voices should show up. Jennifer talked about the Code of Ethics. I use a different quote from the Code of Ethics. Code of Ethics were revised in 2015 by ANA. And I use this comment about nurses are leaders. In fact, in the Code of Ethics, leadership came out even more strongly in 2015 than was there before. Nurses have to be leaders, and that doesn't mean hierarchical, but nurses are leaders, and we need nurses' voices and experience leading. And I think ultimately what it's all about is impact. And I'm very fortunate they have a former CEO of a health system on our board, and he joined our board specifically because he is passionate about getting nurses on boards. And he says, as few CEOs will admit, maybe because he's retired, he said everything in his health system changed when a nurse walked in the door. And it wasn't just any nurse. As he talks about it, and we featured him and her in a couple of national articles out in the general public. Somebody who knew how to create coalition and to have the right conversations. But he said our conversations stopped being about money and started being about quality. And our quality scores changed, and she asked the provocative questions. Remember I talked about your job is to ask about how come the scores are different in our rural hospitals than our urban hospitals? Why aren't we as a board saying we want care at the highest level at all of our hospitals? And he said, and the whole system changed, and that's what the point is, that it's going to make a difference. We talked a little bit about diversity. Again, I'm going to approach this more from, if you're on a board, any board, if you're on your kids' daycare board, you should be asking about diversity. We know that nurses actually represent less board seats now than they did 4 years ago. It actually went from 6 to 5%, which is the wrong direction. Now, we haven't measured it again, so I'm thinking that it is going to increase, and we have got lots of efforts all around the country to do this, from states, from looking at all the magnet hospitals, efforts to do this. But nurses are 5%, MDs are 20%, and other healthcare providers equal 4%. So non-nurses, nurses are the largest care providers in a hospital. Non-nurses are 24%, and nurses are 5%. So that's just wrong based on, if you really want great experience and people who know what that is. We know that hospital boards are primarily male. 75% of hospital board members are men, so only a fourth are women. And this picture, I love this picture because this is a picture of the future state. If anyone knows Marla Salmon, who's on the, she's on the bottom right, former dean at University of Washington. This is one of her boards, and it is a for-profit board for a pharmaceutical out of Spain. And she talks about her journey, and you can find it on our website. We'll give you our website. Her journey of really looking for, she wanted to be on a for-profit board, and she wanted to be on a board where her values were going to align with that company. So I talked to a number of nurses who have been on boards where their values didn't align, and it wasn't a good experience for them, and it wasn't a good experience for the board. So she really was very intentional about wanting to have that. And so here she is with, it's not all of the board, but 4 of her colleagues, just great women in power in Spain. And I was saying at lunch that it's a for-profit board. They pay her, right? And they fly her to Barcelona for board meetings. It's like, oh my golly, that's the best thing ever, right? I totally want that. That'd be great. And so in terms of diversity, right, so we know that minorities represent 37% of the population today, will represent 57%, and 47% of hospitals have absolutely no diversity at all. 9 out of 10 board members are white. So that is completely out of sync with who we need to have around the table. So, but this is one of the challenges that I find as somebody who is out there promoting you all the time, is that this is from a 2013 study that was published in the Journal of Nursing Administration. Only 12.5% of nurses aspired to leadership. Now, you can say some of that might be, how do we define leadership? Is it hierarchical, right? But that's a number that can't ever create the world that I want to see created, that I think you want to create, right? The upside of this is that they found that there's the difference of nurses who are younger aspire more to leadership. Nurses who pursue advanced degrees aspire more. And this is one of the keys that everyone here can do something different tomorrow about this. Nurses who feel like they have the support of their colleagues and their family aspire more to leadership. So, one thing you could do is just say to someone, have you thought about being on a board? And if you do, I will completely support you. So creating that community that says, I'm there for you, we can maybe change that, because 12.5% will not get us to the world that we want to be in. So what's in it for you? Obviously there are opportunities. You're going to grow by being on a board. You are going to be I'm a much better leader from having been on a board, having led an organization, and having learned some hard lessons running that board. I'm a much better leader than that. I was talking to a dean from an academic institution on the East Coast, and she said she was the first nurse who ever led, maybe it was Heart Association, and she said, I learned so much more in my volunteer experience about leadership than I ever did being a dean and an associate dean and all of that. That's where I really learned, and then I brought it back to my school and was a much better dean because of that. So you're going to grow by being on a board, and you should look at that as an opportunity. Part of it is service, but you should be getting something back. It should be a good experience. And the first challenge I will make to you is to move from wanting to do it to doing it, to declaring, as Karen did, I want to be on a board, I want to be on this board, and then going and pursuing that journey. You started that with the smart work you did at your tables about making something specific to go for. But I will be honest that one of my observations about nurses, which is what makes you so great taking care of people, is you are so committed to doing it right? Knowing all of the steps. Guarantee 99% of people walk into the boardroom without knowing all that knowledge. They're gonna learn right there in the boardroom. So we talk a lot at ANA about the 70-20-10 rule. You educators know about the 70-20-10. So 70% of your best learning is learning by challenging experiences. 20% of it is your best learning is by the people that you learn around and being on teams that are outside of your regular day-to-day. And then 10% of it is formal education. But what an inverse, right? So get on a board, you're gonna learn. That's 90% of what you could learn. You're going to learn through that experience. So getting in there and declaring what you want to do, identifying what your passion is, what you're willing to walk away from the dinner table and leave your kids at home, or leave your favorite TV show, or do something at lunch and multitask. What is your passion? And then pursue that. And getting your passion met makes you a better person. And really, if you care about exercise, or you care about animals, you will be more satisfied and happy as a person if you know that you're doing more good in that world. And another colleague of mine said that he talks to his friends and says, this is part of our duty to change public health, is by pursuing whatever your passion is. And it could be animals. That definitely impacts people's health. You will develop key skills that you aren't developing right now in either your academic or clinical situation. And you'll be able to test out new ways of behavior. So every board situation is, again, a service, and you should be getting something back. There are so many opportunities to start locally. There's 1.5 million nonprofits in this country. There's 100,000 starting every single year. If you imagine that they have probably between 12 to 32 board positions for each one of those nonprofits, right? Is there somewhere for you to serve? Absolutely. Right? If you just look right away in your community, Meals on Wheels, your ASPCA, your Planned Parenthood, your PTA, there are so many opportunities for service. So you can start looking, and we talked a little bit about networking this morning, but building connections. I was very shocked when I talked to the national organization that does leadership development. They're often called like Leadership Cleveland or Leadership Portland, and there are opportunities for people to come in and connect with each other and then be supported in their community and go off to board roles. And they said that less than 1% of the people who participated nationally were nurses, which just doesn't make any sense to me. But part of it is we aren't networking right now in these communities. And so this is a little bit more of what you can do. The thing I want to call out, three things, is the second one, be a player and not just an observer. So talking about how the world should understand nursing or how the world should change, this is really your opportunity to do that, to make the change that you want to see happen. And that happens in a boardroom. Expand the public's understanding of who nurses are and what nurses do. That is, nurses often talk about, and I talk about a lot, nurses not getting the respect that they need and deserve, and elevating the image of nursing. But part of that is because nursing is invisible. And you are what makes nursing visible. And so even in your leadership roles, talking about, as a board member, I'm a nurse, and helping people understand, having nurses show up all over the community in leadership roles will make nursing more visible and make people understand what nurses do. Obviously, advance the profession, and then, nobody's joining the Sodexo board tomorrow, but the future is that people do get paid to be on boards. In fact, I know a couple of nonprofits that are beginning to pay their board members because of the time it takes. I'm not encouraging you to do that. I'm not encouraging anyone to ask Jan about being paid, but that is part of lots of other people's worlds, is getting paid to be on boards. I would like nurses to be able to be paid to be on boards. This is the Nurses on Boards Coalition. That is the address. Later referenced going there and putting your name into the database. We have more than 5,000 nurses that have said they want to serve, about 3,000 that serve. And in this particular thing, I always feel the need to tell you what's being counted towards 10,000 nurses by the year 2020. It's boards that are out of the normal nursing world. So it's not counting people who are on my board. It's not counting people who are on the ANA board. It's counting people who are on boards where it doesn't have to be made up of nurses. Because the whole thing is to make the world healthier. You need to get nurses out of the circle of just talking to nurses. You need to do that. But absolutely, we are tracking all the data about what boards nurses serve on that are nursing related, because we want to talk about that too. There is a workshop that we created that's available there that helps you take your CV and turn it into a one-page bio. So there's a free 60-minute video there, and we actually took Marla Weston, who's the CEO of the ANA Enterprise, we took her 32-page CV and turned it into one page where you really talked about, well, what is the value that this particular person is going to bring to a board? This is you can see on a weekly basis as we move to 10,000. I personally think there's probably already 20,000 nurses serving, but we haven't captured that data in our database. So if you know somebody, it's really easy to just go in, put your data in. In the next probably 60 days, there'll be something out to you because we're creating a single sign-on, and it's much more dynamic. But let us know that you want to serve, and take the leap. Fill out that SMART thing. Just go and do it. Go and do it, and not be perfect and not know everything. But just go and say, I'll do it. And as Leda said, it starts with people you know, and then a committee and a volunteer. And we will never be able to match up every nurse who wants to serve with an organization. Nurses are going to have to do that themselves. They are going to have to say, hey, who needs help? We've started actually an exercise with our board meeting of spending 5 minutes and having people just stop doing all the talking and multitasking they do, and think of people you know who are on a board. And just send them an email and say, have you thought about putting a nurse on the board? I want to be on a board. And you'd be surprised how many people know somebody. Oh, my brother, that's right, he runs an organization, he's got a board. Oh, my neighbor, yeah, I think they're on the United Way board. It's stopping and saying, I want to do this, or there should be a nurse on the board. And I think that's it, and I think I've got a few minutes for questions, right? I do. So thank you for what you do, and thanks for being here for a day saying this is going to matter. And it is only going to matter if you step into that place and volunteer and say, I'm going to do something, and then do it well. Questions? Yes?
So I've had great experiences being on a board and boards working for me, but to be truthful too, I've been fired by a board in the past. And
good for you.
Actually, a couple of times I've fired boards. Had to do that a couple of times.
Mm-hmm.
So when I hear this talk, it is enthusing, but it also, I think sometimes it understates that being on a board is hard work. And I actually think that saying out loud that it's hard work is attractive.
Mm-hmm.
I mean, nurses want to do good stuff, they want to work hard, they want to be of value, and I think we should kind of stand on the high ground and say being on a board is hard work. And we look forward to you doing that. Hard work.
That is a great comment.
I've been fired by boards.
And I think you should take that and I think you should take both of those as a badge, because you probably were doing those 7 things, asking questions, and sometimes boards don't want that. They want you to show up and I want to leave. And it is really serious work, and it is hard, and I never thought we could make that part of the marketing of that. But you're right, it is hard work, and you often are forced to look at things that the rest of the world doesn't see.
I'm not sure I've ever met a nurse who couldn't do it.
Right.
Because they're smart, and they're educated. And so saying it hard doesn't take away from any of that.
No, if it makes it more appealing, then I want to talk about it being hard. If that is appealing to you, then I want to talk about that. Joanne, yeah.
I think it's just being aware when you step into doing something. So I've had the experience where you were asked to make a donation to the nonprofit instead of the converse of being
paid.
So just to, and I think that's the thing is that if you may be in the media, so or you may be fired, you know, so, or you may have a conflict of interest. So those are, I think that's important to kind of have that awareness that these are things that may come up if you join this board. So those are kind of things that I haven't heard being talked about.
Yeah, no, absolutely. I'm glad you brought that up. Yeah, it isn't. If it is just easy, you probably aren't being the best board that you can be, because doing something well is pushing against the limits. And sometimes that might be, yes, putting something in the news or making a hard decision that isn't popular and having to go out. In my experience, it was making a decision that was really not popular and having to go out and stand in that and say we made the best decision. I would say that we all really learned and we really came together as a board by doing something difficult together, but it wasn't easy. There are things that you should be asking if you are beginning to talk to someone who is with an organization. You should be asking, do they have insurance? I send the insurance policy to board members. Do they have insurance? What are your responsibilities? How much time? Have there been controversies? What have been the financial obstacles that we've encountered in the last 3 years? I'm surprised how many people do not ask to see my financials before they join the board. That you should always be asking to see the financials and ask some hard questions. And you're not going to get on a board where everything is always super, super easy. Look at the corporate boards who pay people who are dealing with huge issues of responsibility, of difficult things that are going on, and it's not easy. So you're right, and I'm going to take that back to the whole national group and say we should be marketing that it's hard, because that is appealing to nurses, because nurses are such great people. What other questions do people have? Yeah.
So you said to thank the staff. So were you thinking something like a luncheon? Were you thinking a card? Were you thinking a public? What were your thoughts?
Oh, that's a great question. Anything. Just a thank you for doing such a great job. And Janet was here last night working very hard, as was Kate. So just saying that, a card, not necessarily a luncheon, but that's a lovely thing. I think just even really out of the blue saying, hey, you're probably at work, or I got an email from you from 8 o'clock. Boy, thank you so much for doing that. We know as employees that we wish that people thanked us more. And that's a special opportunity. I find that one of the things that I do with my volunteers, and I've never had a volunteer offer to do this, but I've always have them be very happy that they did, is to write thank you notes to donors. It's a really great thing to do, and it's a nice way to get involved in that. And we can never thank people enough, ever, 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 ever. Other questions? Yes.
Well, it's not really a question. It's not as profound as Tom's comment, which I admire. When you mentioned you added a seventh thing that boards do. The other thing that, as soon as I was on a pretty significant board, every single board member said they learned a lot. So that learning that you get, and not only how to behave on a board, but the responsibility that you have to who you're representing, goes back to where I work. So when I go back into my hospital, I look at it from an entirely different lens.
Right.
And so my practice changes. And so the learning that I get from being on a board translates into my practice. And I thought that was really helpful. Changed
Right.
the way that I think.
Yeah, so that's interesting. I could add an 8 of one of your responsibilities is to take that learning and bring it into the other places of your life. That's a great thing. I'm going to add an 8. Thank you very much. Yeah. All right. Thank you very much.